This is Dr. Bharati. I'm here to talk to you on breast augmentation. Since ancient times, the humans have perceived the female breast as a symbol of feminism and a measure of beauty. This perception has prevailed over the years, and women want to look natural, proportionate, and feminine. Being the most important secondary sexual character in a female, the breast not only adds beauty but also imparts confidence and self esteem and plays a major role in the body image concept of a woman. The size and shape of each breast is unique and it depends upon various factors such as heredity, race, ethnicity, etc. There is no such thing called as an ideal breast size. What we also need to understand is that the breast is a very dynamic organ, undergoes changes in size and shape due to aging, fluctuations in weight, hormonal changes, pregnancy, and lactation. We come across a lot of women who come with complaints of having a smaller breast compared to their framework, being more flat compared to their peers of the same age group, not able to get into those fitting clothes, those who feel uncomfortable or embarrassed in swimsuits. We also come across women who feel they are less confident and have low self-esteem and they're not able to achieve their goals in their career. And there are also some who have problems in their relationships, even leading to marital disputes. So who needs a breast augmentation? Women who have a smaller breast compared to their framework, or those who have underdeveloped breasts, those who have asymmetrical breasts, that is a cup size of A on one side and a B or C on the other, and those women who have undergone multiple pregnancy and childbirth and have lost their volume and shape in the process. These women who want to regain their pre-pregnancy volume can opt for a breast augmentation. Breast augmentation is one of the most commonly performed cosmetic procedures worldwide. There are two types of breast augmentation. One is using the implants and the other is using the patient's own fat for augmenting their breast. Breast implants have been there for quite a while and most of us are familiar with it. The most commonly used breast implant is a silicone implant. It comes in various shapes such as round or anatomical. It may be textured or non-textured. The patient's choice of implant depends upon her expectations and the doctor's suggestions and the cup size which she wants to achieve post-operatively. Now this procedure is usually done as a day care under general anesthesia and it takes roughly about 60 to 90 minutes. Now in this procedure the two important things is one is the choice of incision and the pocket of location of the implant. The incision can be placed either in the armpit or axilla or in the periareolar region or in the inframammary region. We most commonly prefer the inframammary incision because not only is the scar minimal, but it's also hidden under the breast fold. Now the pocket of location of the implant depends upon the patient's expectations. If she wants a more projection, then she can opt for a subglandular implant where the implant is placed behind the gland, or a submuscular implant where the implant is placed behind the muscle or that is the pectoralis major. Now, coming to the post-op instructions, the patient is usually discharged on the same post-operative day with medications for pain and antibiotics with plasters over the chest. The patient is requested to come back on the second post-operative day for removal of the plasters and is advised to wear a supportive bra. You can resume work on the third post-operative day and you are advised to avoid cardio for a period of 4 weeks and strenuous exercises and muscle workout for a period of 6 weeks. This is in brief about breast implants. Now coming to breast fat fill. In this procedure, the patient's own fat is used to augment the breast. So usually a liposuction is done either on the tummy or on the back and this fat is processed and used for augmenting the breast. To know more about breast fat fill, watch our next video. Thank you.